Hello, and welcome to the Hawaii Health Data Warehouse Coffee Break Monthly Webinar Series. My name is Tanya Lowry St. John with the Hawaii Health Data Warehouse, or HHDW, in the Office of Public Health Studies at the University of Hawaii at Manoa. We're going to use the next 30 minutes to talk about topic centers and Hawaii Health Matters, or HHM. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for questions and a hands-on activity so that we finish up in half an hour. Let's start with the Hawaii Health Matters homepage, or HHM. HHM was designed to provide a friendly way for users to access and interpret health data. The website has over 800 separate indicators of population and community health with data from HHDW, but also from other national and local data sources. Since it was originally designed with state and county data in mind, almost all the indicators have data for both the state and the county, but many have additional data by other demographic variables like age and sex and race ethnicity. And moreover, HHM contains sub-county level data, such as census places, primary care service areas, and zip codes, and all the way down to census tract data for some indicators. In HHM, it's helpful to think of the health indicators as separate objects or books within a library. They can be viewed individually or in a group in the form of a pre-made tracker, which is a selection of related data that we've created for you, and those are located here in the Track Progress drop-down menu, or as a hand-picked tracker that you can select here under the Find Data, and you can share. This link here on our homepage will take you to a coffee break that provides a complete overview of the tools within HHM. But for today, we're going to go all the way down to the bottom of the page. Here you can find the Topic Centers tile in light blue. It's been lurking here at the bottom of every page, just waiting for you to notice it, and today is the day. HHM uses the Healthy People framework to organize topics and subtopics across the system. So the topics include health, community, economy, education, and environmental health. And the subtopics are used to look at more specific areas within these broad categories. So here you can see the subtopics that are available for health. It's the largest topic area and covers health conditions, such as cancer and diabetes, health behavior, health outcomes like mortality data, and life stage categories. So you'll see adolescent health and children's health and maternal and fetal health and older adults' health and so forth. Next, we have the community topic, and these tend to cover issues about where people live. So civic engagement in that area, community and business resources, elected officials, governance, public safety, and so forth. So this will all be under the community sort of topic area. The economy topics can be seen here, and they include items that are related to things like income, economic climate, employment, cost of living, so housing, poverty, and so forth, workforce development. Those will all be here under the economy tab. And then last but not least, we have the topics of education with these subtopics and environmental health. So it kind of gives you that view of those 5 large topic areas that we have. And while we pride ourselves on our health indicators, as I mentioned, I want to remind you that HHM also houses a variety of other resources, and we house those in our resource library and our funding opportunities and our promising practices. So the Topic Centers then module organizes the content in HHM across these topic areas. So each resource, so be it a health indicator, a report, a map, a fact sheet, a funding opportunity, a promising practice, and more, can each be assigned up to 3 different topic areas or subtopics. So if you know your general area of interest but aren't sure what kind of information is available within the system, then Topic Centers can be a good tool for you to use to search our collections. So let's go and explore the Topic Centers. So here we are at the Hawaii Health Matters homepage. And again, if you want to find out more about the system overall, you can click here, right? And that is going to be our website overview. If you want to learn how to make your own custom dashboards, you can come into Find Data Community Dashboards. If you want to learn more about how to do that, we have a video for those as well. So coming back down to our homepage here, we're going to come down here and we're going to go into the Topic Centers, and we're going to go start with health. And so here you can see that health topic center. As you saw before, we have our most subtopics under here, but you can see all the different resources, the kinds of resources that are available under the health topic. So you can decide to look by type of resources. So if you want to know, for example, what the CDC has, you can click here and you can see we have our CDC resources here. And you'll notice again, as I mentioned, all of the icons have now sort of shrunken, but if you're not quite sure what they are, you can go ahead and hover over and that will tell you what that icon stands for. So here I'm going to go ahead and click on the presentations icon. So you can see we have some presentations. There's the excellent sexual and gender minority youth in Hawaii highlights that are here as well. So this is one way that you can search through the system, but you can also go ahead and search through here with our drop-down menu. And our drop-down menu is going to show you both all of the topics in subtopics under health, but actually all of them within the system. So if you kind of know the name, you can start typing, or you can just scroll through to find something that interests you. So we're going to take a quick look at the maternal, fetal, and infant health data. And you'll notice then that the icons have now changed, right, to show that this collection only has these types of resources available. And we can go ahead and click on promising practices here. And you'll see here that it will show you a maximum of 6, but there's up to 80 different topic items in this area. So if I click on here, it's going to bring me to the Promising Practices database. And this is a database of documented approaches for improving community health and quality of life. This is a collection of resources that has been curated by the Healthy Communities Institute. It includes local data as well. And what you're looking at is a filtered version of our complete database. And you can come down here and you can see we're just looking at the resources under maternal and fetal health. But you can go ahead and in infant health, you can go ahead and actually filter this further. For example, if you're only interested in evidence-based practices, and you can hover over these icons to see what the difference is on the kinds of practices, maybe a particular kind of resource, maybe a particular target audience, or also a geography, and you can filter that resource further. You can go ahead and click on any of these, and that will give you that background information. This is an evidence-based practice at the CDC about how to do a community-wide campaign to promote the use of folic acid supplements. And so they have a bunch of information in here. So what it'll do is by using the topic centers, you can go ahead and focus in on what kind of promising practices are available. So coming back here a little bit further to our topic centers, we can also go ahead and take a look at our health indicators. And again, we can see a selection of health indicators here. They look suspiciously alphabetical, but you can see we have 63 different items. By clicking here, the astute observer is going to notice that we've actually gone to the build a custom dashboard, and we've built a custom dashboard based on this subtopic of maternal, fetal, and infant health. So these are all of the indicators, health indicators that we have in the system in this topic area. And you can see that what the indicators names are and what the geographies that are available in the system. And each of them are tailored towards the kind of underlying data that it has. You can stick here, or you could say, maybe I'd like to sort of see what this data looks like. So I can go ahead and do something like I want to look at it for the state. So I can filter for the state and I can group by indicator and hit search. And then I will see sort of a snapshot for each of these indicators of what the underlying data looks like within the Hawaii Health Matters site. So for example, here's adults who visit an OBGYN. I will have the value is 15.9%. What the year is, a comparison to the next highest geography. In this case, it's data for the state. So the comparison is the US, the prior value, and the trend where available. And you'll see that for all of the indicators for which we have state data, they're going to appear. Similarly, if I'm interested in maybe sub-state data, I can say I'd like to look at the data for Maui County instead and search. And then it's going to filter this whole dashboard for me by the data that is available for Maui County. And so again, we have the comparison for the county compared to the next highest geography is the state, then the US, and then the prior value. And you can see down that all that information is there. So this is an interesting way that can help you find data. And then if you're interested in learning more about one of these data points, you can always go ahead and click on the data indicator itself. So for example, if we're going to look at babies with very low birth weight, for example, we can click here, and then that will bring us to the full report within the system on that. For the county of Maui, we can change it back to look at the state if we'd like, the measurement period, the definition, our overall information, and all the collection of other related data that we have to this indicator within the system. So the health topics can be an interesting way or a quick way to sort of look at data differently within the system. I'm going to come back here and I'm going to put up a quick activity for you to do to explore the Health Topics Center. So take a look at the Community Topics Center and see what kinds of resources are available. Can you locate and explore the data resources? And then for economy, which funding opportunities are available, how many reports are there, and how many health indicators are there? So I'll give you a minute to play with the system, and then we'll come back and do the answers. Okay, let's take a quick look and see if we can answer these questions. So first of all, the question is community, what kind of resources are available? So I can come down here to the community resources and so we can go over and look at the Community Topic Center, and you will see that these are the resources that are available for Community Topic Center. So there are quite a few different resources. And if we're going to look at the Explore the Data resources, so we would go ahead and click on this icon here, and you can see that we have the following data resources. You might notice one of them is starred. So that was a featured resource on our website one month, just as a little FYI. And then the next thing that you can see is the question is to go to the area of economy. And so which funding opportunities are available? So we went ahead and clicked here, and you can see that there are 4 different funding opportunities from national foundations. This is a neat repository that is kept up by the Conduit Healthy Communities Institute that puts in a bunch of different foundations that have funding opportunities available. It's always an interesting place to look if you're looking at trying to come up with community solutions. And then the next question is how many reports are there in the system? So coming to the report icon, you can see that there are 62 items in this topic area. So those are different reports that we have put up. And again, a reminder, if you have reports that you've made that you'd like to have disseminated through the website, we are certainly happy to do that. So let us know. We always coming looking for new data. And the last question is how many indicators are there, health indicators? And if you clicked on this here, you'll wind up and you'll see that there are 86 different health indicators in the Economy and Topic Center. So having said that, I just wanted to thank you very much for your time for attending today and invite you to join us next month on Tuesday, June 4th at 11 a.m., where we will be debuting the 2022 Pregnancy Risk Assessment and Monitoring System data in HHGW and Hawaii Health Matters. If you have any questions at all, please contact us at profiles@hhtw.org. And thank you for spending time with us. Mahalo and enjoy the rest of your day.